Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Julia Townsend, and Carlos Saracedo is interpreting the press conference in Spanish. His interpretation will be available shortly after we conclude the press conference on the county's website and YouTube page. The right to vote is the foundation of our democracy. Santa Barbara County voters cast a record number of votes in this election, with the turnout of registered voters exceeding 90%. Santa Barbara County Registrar of Voters Joe Holland and his elections team deserve great credit and praise for running our local elections flawlessly. The county elections team quickly pivoted in response to the pandemic with creative new ways to vote. Election staff created new ballot drop-off locations throughout the county and opened polling locations 4 days before Election Day. Here in California, we're very comfortable with voting by mail and understand it takes time to count votes that are cast on Election Day, and also understand it takes time for ballots to go through the mail to the elections office. Patience is required to allow the professionals who count the ballots to do their work. Every single vote will be counted. We will know the results when that work is complete. I want to take this opportunity to also congratulate the community of Isla Vista for the responsible and effective response to the challenge posed by Halloween last weekend. Isla Vista residents celebrated Halloween at home, enjoying the festivities with their housemates, and participating in virtual Halloween programming. The residents of Isla Vista provided a great example of how all of us are capable of doing things differently in order to keep our county safe and healthy. Thank you to the County Public Health Department, UCSB, Santa Barbara City College, Supervisor Hartman's office, the Isla Vista Community Services District, the Isla Vista Recreation and Park District, the County Sheriff's Department, and many other local service providers for helping keep Isla Vista residents safe at home during Halloween. Unfortunately, some high school students in Orcutt did not make the same responsible choices. A Halloween party in Orcutt, attended by a large number of high school students without masks, has resulted in COVID-19 cases among students who attended the party and led to the closure of St. Joseph's High School, along with Rigetti High School sports practices. At this stage of the pandemic, it is frustrating to learn about these kinds of events, given the potential consequences to the entire community. Large gatherings are a serious threat to public health and can also hurt local businesses and close schools. Let this be a teachable moment for every parent of a teenager in our county. The election has temporarily pushed COVID-19 news off the headlines. COVID-19 cases continue to spike dramatically across Europe and the rest of the United States. England has closed businesses, and hospitals are again stretched to capacity in states around the country. Cases are also increasing around California. Yesterday, Ventura County and San Luis Obispo County public health officials reported the highest number of single-day COVID-19 cases since the summer peaks. Here in Santa Barbara County, our local cases have been slowly edging up over the past month. We've heard from local health experts that we're likely on the edge of a new surge in COVID-19 cases over the fall and winter. We must do our personal best to stay committed to keeping ourselves, our loved ones, and our neighbors safe by wearing masks, avoiding gatherings with others, and consistently washing our hands. It seems so simple, but we need to keep this up through the holidays. Some people are still confused about what is or isn't allowed under the new state guidance regarding gatherings. At this point in Santa Barbara County, our public health officials have recognized the critical moment we are in and are continuing to be careful. The Santa Barbara County Public Health Department continues to discourage gathering with anyone outside of your household. With the holidays approaching, if anyone listening is confused and believe that visiting our relatives and friends during the holidays is an irreplaceable expression of our love for them, it's important to recognize that gatherings can also inadvertently, unknowingly spread the virus to someone you love. This week, we have seen 3 consecutive days of more than 1,000 COVID-19 deaths nationwide. The last time this happened was in August. Yesterday, the CDC announced that they are predicting an increase in deaths over the next few weeks, with up to 11,000 deaths expected in the last week of November. While it's true that increased testing has a role to play in rising case rates, the increasing death rate is a stark indication of the serious threat that COVID-19 continues to pose to communities like ours. Please, let's all continue to be very careful and take extra care this holiday season to protect those we love. Working together over the past 2 months, we brought Santa Barbara County COVID-19 cases down dramatically. If we continue to persist, we can keep cases down, reopen schools and more businesses, and continue to live our lives and be safe at the same time. For the most up-to-date information about the status of the virus in our community, please visit the county's public health website at publichealthsbc.org. Since March of this year, the county website has received 5.2 million views from 677,000 discrete viewers. In addition to COVID-19 data, there are informational videos that help explain and answer complex questions about the virus. This upcoming Tuesday morning at 9 a.m., the Board of Supervisors COVID-19 update, the county will be unveiling a new community collaboration that helped develop a new data dashboard on the county website with improved graphical representation of COVID-19 data. The unique community collaboration that upgraded the website includes representatives from the medical community, business leaders, and government officials who worked together for months to improve the quality and accessibility of information on the county's website. You can view the presentation and see the new improvements live on Tuesday morning on Channel 20 or the county's YouTube page, or by watching the meeting anytime on the county's website. I'd now like to introduce Dr. Del Reynoso, the County Public Health Director.
Thank you, Supervisor Hart. Good afternoon. I'd like to begin also by extending thanks to the Isla Vista community and to our overall community for making sacrifices, for being creative, and for following safe practice guidelines for Halloween. It was wonderful to see so many houses decorated and helping to spread the spirit of the holiday in a very safe way. Santa Barbara County remains in the red tier. According to the state's blueprint for a safer economy, the red tier means substantial spread of COVID-19 within our community. Our adjusted case rates have been inching up week by week. 4 weeks ago, it was at 4.2. 3 weeks ago, it was 4.3. It inched up to 4.4 last week, and our current adjusted case rate during this rating period is 4.6. Our testing positivity rate is 2.2, and health equity metric is 3.2. So it is our case rate that is holding us back. In order for us to move into the less restrictive orange tier, we will need to decrease our adjusted case rate to 1 to 3.9 per 100,000, or no more than 17 cases per day for our county population. It is within our direct control as a community to move into the orange tier. We're almost there. If we can only work to continue to practice vigilance in adhering to the safety guidelines and decrease our overall case rates. Other counties have been able to move forward towards the less restrictive tiers, and I know that we can too. I urge everyone to do your part to decrease the transmission of COVID-19 in our county. Please wear your face covering, maintain physical distance, wash your hands, sanitize surfaces that are frequently touched, and limit gathering with others outside your household. As we have seen throughout the county and state, and even in our country throughout, outbreaks can happen when there is a large gathering. Once again, I urge you to limit attending events. Testing continues to be made available in Isla Vista, and it is being very well utilized. The testing site will continue to be available through Saturday, and appointments are booked at this time, but limited walk-ins are being accepted. I'd like to also talk a little bit about the flu vaccine this year. Due to the COVID-19 pandemic, getting a flu vaccine is especially important to protect ourselves, our families, and our community from the flu. Additionally, the flu vaccination will help save limited medical resources necessary for the care of COVID-19 patients. Just like wearing a mask, getting a flu shot is an easy, safe action we all can take to stay healthy during this pandemic. At this time, we have over 3,700 people in our community having received the flu vaccine from the Public Health Department flu shot events, and we continue to encourage all to do so. We have several opportunities for free flu shots at walk-up clinics in the next several weeks. All community members, 3 years of age and older, are invited to come to these events. No identification or appointment is needed, but we are requiring face coverings. We will have 3 events in Lompoc on November 9th, November 16th, and November 19th. We will have 1 event in Guadalupe on November 12th, in Santa Maria on November 13th, and in Santa Ynez on November 17th. These dates and locations and times will be posted on our website after the press conference at sbcphd.org. Thank you for all your efforts in keeping our families and friends safer by wearing your face covering, maintaining your physical distance, keeping good hand hygiene, limiting gathering to those not from your household, and getting your flu shot.
Thank you, Dr. Del Reynoso. Suzanne Grimacy is also here with us today from the county's Department of Behavioral Wellness.
Thank you, Supervisor Hart. As Supervisor Hart began so well highlighting, this week launched Election Week, yet another thing that has been changed by COVID-19. With more mail-in ballots, it means more time to simply wait. We don't know yet who our new president will be, but what we do know for sure is that no matter what party one might be voting for, many people are feeling stress right now. I shared last week of a survey that the American Psychological Association conducted several months ago, and they found that over half of the participants shared that the 2020 election was considered a significant stressor in their life. The APA reissued this survey just last month, and the number has increased to 2/3 of Americans finding that this election has a significant source of stress in their lives. I share this data for the main reason to validate that if you're someone feeling stressed right now, extra stressed, that's normal feeling right now, and it's shared by many people. I want to share some things that you can do right now while we continue in this waiting period for the outcome of the election and all that will come with that. 5 things. 1 is to practice breathing. There are a lot of different approaches for it, but they all follow the same techniques of slow, methodical, intentional breathing. Breathing grounds us, and it helps our bodies to reject the fight or flight response that we so often feel with stress. The next is to avoid focusing on worst-case scenarios. Find things that can distract you, things that will keep you from checking the news regularly right now to find the results. The next is to stay connected with family and friends. As human beings, we are wired to be connected with others. Disconnection can cause people to feel more anxiety, isolation, loneliness, and stress. So try to set boundaries in conversations when they become uncomfortable surrounding the elections, but stay connected. Next, get outside and move. However you do it, whatever you do, get outside and move your body. And lastly, focus on things that you can control. There's so much right now that we feel we can't. Focus on the things that you can. The Department of Behavioral Wellness and the Community Wellness Team has been offering different resources to the community to help with the stress being felt right now surrounding the election. One of those, the Community Wellness Team line, remains available for people to call at any time to get connected with resources or simply to have a confidential conversation. In addition, Each night, the behavioral wellness team and community wellness team have been offering online listening and support spaces offered through Zoom. That will continue through tonight from 5:30 to 6:30 this evening. This is available in Spanish as well, and anyone is invited to join. On the Behavioral Wellness website, you can find information about these spaces as well as the Zoom links, as well as different additional tips on stress management surrounding the elections, a lot of resources for organizational providers or community members on having dialogues during a difficult time to do so. So I encourage you to go to that website to get that. I also want to share of a different resource that's available for the community as we enter the holiday season. Behavioral Wellness and the Community Wellness Team has developed a senior holiday phone bridge program that's designed to provide support for older adults in our community during the holiday season and beyond. In addition to the current stressors that we're feeling with the pandemic and the social isolation being experienced by older adults, we have many older adults in our community that are living in a living environment where visitors are not permitted at this time to assure the safety due to COVID. Loneliness and social isolation not only has the impact on a person's mental health, but it can have a significant impact on an older adult's physical health as well. Holidays can be lonely times of the year for many people, including older adults who may not live near their families. Holidays carry memories, and they have an expected feeling of a time when families should be surrounding. And this year, many will not be able to be surrounded by their families as they normally would be, due to being safe surrounding COVID. Not being able to look forward to this time of the year and time spent with families can have a profound impact on mental health of our older adults who may already be feeling isolated. It's so important, whether you're a family member or just as a community member, if you know an older adult that may be in this situation, away from family or isolated, to help to ensure as many traditions as possible for that person during the holidays. Stay connected, send cards, call, videos, and whatever your holiday traditions may be, help to continue those on. Those interested in the Holiday Senior Phone Bridge program may call the Community Wellness Team at 805-364-2750 and sign up for a phone call or sign up for a series of regular, friendly, ongoing phone calls throughout the holiday season. We truly are in this all together, and with that, we will all get through this together. But let's make sure that nobody has to do it alone. If you know an older adult who may benefit from this service, please feel free to call the Community Wellness Team or to pass this information on to them. Thank you very much.
Thank you, Ms. Grimsey. We'll now go to questions from the room. Mr. Devine?
So my first question is, obviously right now we're now in November. A lot of people are starting to plan ahead. And I guess what is your guys' advice for people planning for Thanksgiving festivities?
I'm glad you asked that. We are developing our guidelines per CDC recommendations, and we anticipate releasing it shortly next week.
And I guess my question is, if people are planning to have relatives or have college kids coming in, what should people be kind of expecting as far as that goes? Should they only try to have Thanksgiving with people in their immediate household?
The current recommendation is to limit mixing with those outside your household, and it really depends on where that family is coming from or where that college student is coming from. But I appreciate your question, and we're drafting a set of guidelines, and we are going to be releasing it very early next week.
Okay, and then my next question is, how many total cases resulted from that Halloween party in Orchid?
So far, as of this afternoon, we know of 2 confirmed cases.
Okay. And then my other question, kind of going along with that, has there been a surge in people getting tested because of potential exposure on Halloween?
Halloween, or the results from Halloween testing is still too early to tell. We are collecting the information, and we will know for sure by end of next week.
And then lastly for me, I know you've mentioned we've been inching a little bit with more cases, but at this point, are we closer to reaching the orange tier, or are we actually closer to getting pushed back into the purple tier?
At this point in time, we are solidly in the red tier towards the orange tier rather than towards the purple tier.
Makes sense. Thank you.
Thank you, Mr. Devine. Next, we'll answer questions on the phone.
Yes, first up is Laura Place with Santa Maria Times.
Hello. I was wondering about the gathering health order in the county. I know that gatherings are now permitted on a county by county level in the state, but Santa Barbara County has kind of maintained an anti-gathering health order for a while. Are there plans to keep that in place for the time being, or any plans to repeal that anytime soon?
We made the decision to be more restrictive here in Santa Barbara County out of the protectiveness for our county, for our community's health and well-being. We will be examining whether to extend that health officer order when it expires or to rescind it this next week as well.
Okay. What kind of metrics would you want the county to be meeting before you felt comfortable lowering those limitations?
We are looking at case rates.
Gotcha. Okay, thank you.
Thank you,
Thank-
Ms. Place.
Next up, we have Lisa Osborne with KCSB Radio.
Hi, thanks for all the great information. I noticed on your site for making an appointment at Ivy Theater that you're suggesting that UCSB students reach out to Student Health to be tested through the university. Are you announcing those numbers, or how will we get the results directly from the university, or will Public Health be announcing the cases that come out positive that UCSB finds?
We will be doing it jointly. So all confirmed cases will be reported by Public Health, but we are also working in partnership with UCSB.
So case numbers have been lower this week, and is that because it's taking longer to actually have the results be announced through the county and to show up on your status report?
So the results come in, and we are seeing roughly a 2-day turnaround time. And so they are reported on the daily new cases, and then they get attributed by episode dates in our graphs and in our data as well.
Thank you.
Thank you,
you,
Ms.
Lisa.
Osborne.
There are no further questions.
Thank you for the questions. On Tuesday at 9 a.m., the Board of Supervisors will hear a presentation from the Public Health Department announcing the county's newest weekly state report card. Our next press conference will be held a week from today on Friday, November 3rd at 4:30 p.m. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home, don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient in your interactions with others. We are stronger together, safely apart.